Antibiotics are medicines that are used in the prevention and treatment of bacterial infections. The discovery of antibiotics has been one of the greatest benefits science did to us. Now imagine visiting a doctor for a minor and simple infection, like a urinary tract infection, throat infection, etc., and your doctor replies that there is nothing that they can do about it. This is what antibiotic resistance will lead us to. Antibiotic resistance is when bacteria transform themselves and antibiotics can no longer kill them or minimize their growth. It is increasing day by day and bacteria are getting harder to treat. Infections that are caused by antibiotic-resistant organisms are impossible to treat in many cases. This is the major problem that health systems face worldwide, as it prolongs the hospital stays, increases treatment costs, and discomfort to the patient. The alternatives selected to treat antibiotic-resistant infections are of a high price and toxicity. Antibiotic resistance not only affects people, but also has the potential to affect veterinary, healthcare, and agriculture industries. The risk of antibiotic-resistant infections varies from person to person. Some are at higher risk than others, but no one is entirely safe from the risk of getting these infections. Antibiotics are the go-to source for not only infections, but also help in preventing complications during surgeries, chemotherapy, dialysis, etc. At times, they are only used as a preventative measure to prevent infections. The leading cause of the development and spread of resistance is the careless use of antibiotics, which is making the bacteria stronger. Bacteria are finding new ways and mechanisms to develop resistance. In many countries worldwide, antibiotics are sold without a prescription, and there is no regulatory authority that has been successful enough to control this improper and careless use. The absence of pharmacists in many countries has made the scenario worse, as many of the physicians prescribe antibiotics for viral infections which don't require an antibiotic. Viral infections go away on their own after completing their cycle and require symptomatic treatment only. Antibiotics cannot kill viruses. Not having a sound knowledge regarding the use of antibiotics is also a reason. Many people miss a dose and they think that maybe we can take the double dose together so the effect remains. Remember, if you ever miss a dose of antibiotics, either take it as soon as you remember, or if the time of the next dose is near, skip the dose that you missed. If the practices and habits remain the same, we'll soon be heading over to the times where it'll be again impossible to treat minor infections, and once again, people will die because of minor diseases. There are specific necessary steps that can be taken to control the overuse and misuse of antibiotics. The inclusion and development of pharmacy services can help doctors and nurses in regulating the use of antibiotics. Moreover, it will help the patients to understand their disease and medicines better. Policies should be made by the government to control the sale and purchase of antibiotics without the prescription of a certified healthcare professional. Try to stay hygienic in all means so that you don't catch any infection in the first place, but even if you do, always follow the instructions of your healthcare provider and never use or share the leftover antibiotics. Awareness campaigns can be organized to educate people about the correct use of antibiotics. Most importantly, the prescribers should take responsibility while prescribing antibiotics so that the people who come to you while trusting you won't be harmed. Antibiotic resistance is the major healthcare crisis the world is facing. Everyone should be responsible to some extent to help combat this issue.